Have you ever stopped to think about how integral your sense of smell is to your daily life? From savoring the aroma of fresh coffee in the morning to detecting a gas leak, your ability to perceive odors is more critical than you might imagine. The olfactory nerve, also known as cranial nerve I, is the key player in this sensory system, but it is also prone to various disorders that can significantly impact quality of life. In this video, we'll explore the anatomy, function, common disorders, and clinical correlations of the olfactory nerve in detail. So, grab a seat and let's dive into this fascinating topic. Anatomy and function of the olfactory nerve. The olfactory nerve is unlike any other cranial nerve. It is the first of the 12 cranial nerves and is responsible for detecting and processing smells. Its unique structure begins with specialized olfactory receptor neurons located in the nasal cavity, specifically in the olfactory epithelium. These neurons detect odor molecules in the air and generate electrical signals. The signals are then transmitted to the olfactory bulb, a critical structure located at the base of the brain. The olfactory bulb acts as a processing center, refining the signals and sending them to higher brain regions like the olfactory cortex, hippocampus, and amygdala. These areas interpret the smell and link it to memory, emotion, or behavior. Unlike most cranial nerves, the olfactory nerve does not pass through the thalamus. Instead, it provides a direct connection between the external environment and the brain, which explains why smells often evoke vivid memories and emotions. This direct pathway underscores the olfactory nerve's unique and vital role. Let's discuss what happens when the olfactory nerve doesn't function properly. Common smell disorders. Smell disorders, though often underestimated, can have a profound impact on a person's life. Anosmia, or the complete loss of smell, is perhaps the most well known condition. It can be caused by a variety of factors, including nasal obstructions, viral infections, head trauma, or exposure to certain chemicals. Partial loss of smell, known as hyposmia, is also common and can be just as disruptive. Interestingly, anosmia gained widespread attention during the COVID-19 pandemic as it emerged as one of the hallmark symptoms of the virus. Beyond viral infections, neurodegenerative diseases like Parkinson's and Alzheimer's are also associated with smell loss, often preceding motor or cognitive symptoms. Other conditions include parosmia, where familiar smells are distorted, and phantosmia, where individuals perceive odors that are not present. These disorders can lead to significant challenges, including loss of appetite, weight changes, and emotional distress. Diagnosis of smell disorders. Diagnosing smell disorders requires a comprehensive approach. The first step is taking a detailed patient history, focusing on the onset, duration, and possible triggers of the symptoms. A thorough physical examination of the nasal cavity is essential to identify potential obstructions like polyps, tumors, or inflammation. Imaging studies such as CT scans or MRIs are often used to assess the olfactory nerve, olfactory bulb, and related structures. These tests can reveal structural abnormalities or damage. Specialized olfactory tests, including identification tests, threshold tests, and discrimination tests, are also commonly employed. These tests help quantify the severity of the smell disorder and differentiate between various causes. Advanced techniques like electroolfactography measure the electrical activity of the olfactory epithelium, providing additional diagnostic information. With a diagnosis in hand, the next logical step is exploring the treatment options available. Management and treatment. The treatment of smell disorders largely depends on the underlying cause. For conditions like nasal polyps or tumors, surgical intervention may be necessary to restore airflow and olfactory function. If the cause is a viral infection, recovery often occurs spontaneously, though corticosteroids can be used to reduce inflammation and promote healing. In cases of neurodegenerative diseases, while the primary condition may not be reversible, certain interventions can help manage symptoms. Olfactory training, for instance, is an emerging therapy that involves exposing patients to a variety of scents over time to stimulate neural pathways and improve function. Additionally, addressing the emotional and psychological impact of smell loss is crucial. Support groups, counseling, and even dietary modifications can make a significant difference in a patient's quality of life. Understanding treatment options helps us appreciate the broader clinical implications of the olfactory nerve, which we'll discuss next. Key concepts. The olfactory nerve's role extends beyond just detecting odors. It is deeply connected to other sensory and emotional systems, playing a pivotal role in taste perception, appetite regulation, and even mental health. For example, individuals with anosmia often report reduced enjoyment of food, which can lead to nutritional deficiencies or weight changes. Furthermore, the olfactory nerve serves as an important diagnostic tool. Its dysfunction is often an early marker of neurological conditions like Parkinson's and Alzheimer's. This makes it a critical focus for both clinicians and researchers. The key takeaway is that the olfactory nerve's functions are wide ranging and deeply interconnected with overall health and well being. Clinical correlation. Now that we've discussed the key concepts, let's take a look at some clinical correlations. Understanding how the olfactory nerve functions and how it can be affected by various conditions helps us connect out in real life scenarios. For example, a 65-year-old patient presents with a gradual loss of smell and difficulty recognizing familiar odors. This could raise suspicion for early stage Parkinson's disease, as olfactory dysfunction often precedes motor symptoms in such cases. Alternatively, a patient involved in a car accident with head trauma and immediate anosmia may indicate damage to the olfactory nerve. These real world connections underscore how important it is to consider the olfactory nerve when diagnosing conditions, as changes in smell often act as a warning sign. Now, here's a question for you. A 65-year-old male presents with gradual anosmia, no significant head trauma, but a history of motor symptoms. What would be your approach to further investigation and management? And how would you differentiate between a neurodegenerative cause and a more benign issue? Drop your thoughts in the comments below. I'd love to hear your insights. If you would like to watch my other lectures on topics like the lungs, kidneys, liver, brain, and eyes, visit my channel to view my other videos.